Good afternoon. I'll keep my comments brief to leave time for questions. A couple of highlights to point out that the county executive mentioned is overall in terms of our demographic numbers that we're looking at in our dashboard. We have surpassed 11% of our population tested. We've tested as of this morning 11.3% of our population. The test positivity rate for our county continues to come down. In fact, even today with a report of 103 cases, those 103 cases were out of 3,973 tests. And so that comes to a test positivity of 2.6% and is evident of the increased testing that we're seeing across the county as evidenced by the increased testing in our healthcare centers, but also in the increased testing opportunities that we have expanded in the county, including expanding access to our current standing sites, the pop-up sites that we have in place. For example, we had a pop-up event at Silver Spring Civic Center yesterday that tested over 700 individuals. And in combination with our test site that's regularly open at the White Oak Station, just by the county programs testing yesterday, we tested over 1,000 people, which was a record for our services. Now, again, we don't celebrate that. We want to continue to expand. And based upon the data that we've looked at across the board in our zip codes, the top 10 zip codes where we've seen the most cases, we've also seen the most tests. 9 out of those 10 zip codes have tested over 10%, or 10% of their over 10% of their population have been tested to date today. And as time has moved forward, we have seen the percent of residents tested increase. We've seen the number of tests offered and taken increased. We've seen test positivity rates for all geographic areas as well as racial and ethnic groups decrease over time as well. I know that there was a story that talked about the increased percentage of cases within the Latino community in the county that came out yesterday or today. I do want to highlight that it's important to note for the data that we have that does show racial and ethnic categories for testing data, we actually see the highest number of tests in the county overall, as well as those top 10 zip codes that we've mentioned before. The highest number of tests have been in the Latino community. And in addition to all the other categories, we have seen improvements in terms of the number of cases on a daily basis. If you think back to June, we were seeing averages of 300 a day. Now we're at the point where it's anywhere between our 3-day averages are somewhere between 50 and 75. So that shows significant progress across the board. Now we do recognize, though, as the county executive mentioned, we still obviously have cases and we have plateaued in a sense. We've been hanging out at that average for a while now. We want to see continued improvement before we talk about moving to other phases of reopening. And so what we have been working internally is to try to figure out what are those factors continuing to drive those as we continue to ramp up testing. We know that that's important, but what are the factors that are predisposing people to getting COVID-19, and how do we set up policies and have discussions to remove those particular factors? So we continue to push, as the county executive mentioned, conversations to talk about how we create policies that create effective change to remove those systemic factors that are predisposing folks to getting COVID more frequently, as well as having worse outcomes. Now, part of that, we recognize we certainly don't have all the answers. We have partnered with our colleagues in Prince George's County and the state to get assistance from the CDC. The CDC has sent a team here. They've been on site for over a week now to help us with that. And part of that strategy is being to help assist in pulling apart the numbers even more to get a better understanding, but also reaching out to the community and conducting objective research to find out what factors are motivating people to get tested or not get tested. What are the barriers in place, and how can we improve and enhance the message that we provide, as well as enhance the level of participation that the community has in terms of creating and furthering this outreach. We have more details to put out once we crunch the numbers even more, to highlight and show those test positivities by different groups, to demonstrate and confirm that we are moving in the right direction, even though we still have a lot of work to do.